Is my lower eyelid cheekbone puffiness too difficult to get rid of with lower eyelid blepharoplasty? I have puffy lower eyelids, puffiness around cheekbones. The bags look like there's fluid or fat that hangs over and stops at the cheekbone. I would love to have a smooth, non puffy look around the cheekbone area. I would like to get lower lid blepharoplasty. Is my case too difficult to treat since the puffiness falls in and around my cheekbone area? What should I do? I am prone to scarring. Would my lower eyelids keloid or scar badly?
Thank you for your question. You've submitted a question where you're asking if the area over your cheekbones is too difficult to treat with blepharoplasty, and, and you've submitted some very good photos that demonstrate this area. Well, certainly the question is a very, very valid question. This area has been a frustration, an area of frustration for anyone doing surgery in the eyelid and face area. We refer to this chronic elevation in this area as malar edema or malar festoons. Now, you don't really have festoons because festoons are like bags that kind of hang over, but that type of swelling is unfortunately the type of swelling that is difficult to address surgically. Many methods have been tried over the years. I've been a practicing oculofacial plastic surgeon for 20 years, and I have seen the presentation of everything from CO2 laser to cauterization under the skin. And unfortunately, a lot of these methods can actually worsen the problem. Let's understand a little bit what the issue is. This area is edema or swelling, and it's swelling, which means there is fluid that is within the tissue. So it's not like there's a little bag of fluid that you can stick a needle in and then aspirate out the fluid. So when I see a patient with this, I ask them some basic questions about what the possible causative factors could be. Typically, this malar swelling can be associated with smoking, allergies, sinus problems, and unfortunately last, genetics. So if there, on that list, there are things that you can address. If you're a smoker, do your best to stop smoking. Allergies, manage the allergies. Sinus issues, manage the sinuses. If this is a genetic factor, then you're not likely to get a benefit from a surgical procedure. There are selected patients who we will try different things to try to shift the focus away from those lines by the strategic use of various fillers. We even use something called platelet-rich plasma. We've had some variable improvement because the platelet-rich plasma, which is drawn from your own blood, has vascular growth factors. And so we believe that we're trying to improve the circulation to the skin in that area. But ultimately, it's a matter of trying to improve the appearance, but not definitively remove this area. We are all constantly looking for solutions for this, but if any of the previously mentioned risk factors are things that you do have that you can treat, then by all means address that. Until then, I would suggest avoiding surgery and meeting with some doctors and getting some opinions, because the thing that we can't do with the photo alone is have a three-dimensional appreciation of the volume and projection of this area, as well as how it impacts on you. You know, photographs and your eyes are very different. So when you actually see a person with this type of situation, it's easier to actually make a good assessment of the situation. So I hope that was helpful, and Thank you for your question.